Oh, you did? Take a minute now. Yes. Surprise, surprise.
Okay, can I maybe towards the edge so I can get it?
Now, by nature, I'm a wanderer.
Estamos en la sí, pero los podcasts están grabados. Pues que es más cercano, pues van a hablar ahí. Por eso me pasa también aquí me puedo.
Oh, yeah.
Okay, should I get started? So, good afternoon, everyone. As it gets a little darker every day, we're here for some bright light and sunshine indoors. I'm Peter Berman, Director of the School of Population and Public Health here at UBC, and this is our third monthly Voices in Health event, developing Canada's new food guide and healthy eating strategy. To start us off, I do want to acknowledge that our event takes place on the traditional, ancestral, and unceded Indigenous territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And as always, we are grateful for the opportunity to convene in this beautiful location for our events of learning and sharing. Our Voices in Health series is bringing in outside speakers. We're alternating monthly between topics more relevant in global health and those more relevant in what I would call local health, not wanting to make too much of an effort to define that boundary, because almost everything that's relevant in one is probably relevant in the other, but the focus is a little bit different. So our next event will be occurring on Monday, December 9th at this time, and we look forward to welcoming speakers who will be visiting us from Uganda and sharing some of their experiences. Please keep your eyes peeled for more information about that event. And that's all you get to hear from me. I want to pass the mic over to Dr. Kate Weinberger, who will be moderating our session today. Thanks, Kate.
Okay, well, thank you, Peter, for the introduction, and welcome to all of you. Thank you for coming. Peter said, my name is Kate Weinberger. I'm an assistant professor here at the School of Population and Public Health. And before we dive into the event, I want to go over just a few housekeeping items. So first of all, I want to mention that we are live streaming to UBC Okanagan, who is hosting this event at the Institute for Healthy Living and Chronic Disease Prevention in partnership with us. And we're also live streaming to the wider UBC community. And so we'd like to encourage you, both those of you who are here in person, and also those of you who are joining us by live stream, to promote this event through social media using the hashtag, do we have it up here? No, dear. Okay. It's hashtag SPPHVIH. And if I saw a marker, I would write it up. So perhaps I'll do that when our speaker starts. So again, that's SPPH VIH. So that's the first piece of housekeeping. The second piece is I just want to go over our schedule for the next 2 hours, so you have an idea of what's coming. So from now, when I stop talking, until just before 5 o'clock, we're going to have our keynote lecture from Dr. Hassan Hutchinson. We're going to take a quick 5-minute break, hopefully from 4:55 to 5 o'clock. So do your best to be back on time. Then what we're going to do is have about 40 minutes for a panel discussion. So we'll do about half of that. We'll bring up our 3 panelists and they'll introduce themselves and reflect on Dr. Hutchinson's talk. Perhaps ask him some questions. We'll try to generate some discussion that way. And then for the next 20 minutes, we're going to open it up to questions from the audience. And again, that'll be both from those of you who are in the room and also to people who are joining us by live stream. I understand that you can contribute questions through our YouTube link. All right, and then we'll wrap up. So before I keep going, one note, which is that as you may have been able to tell from the way I was describing the schedule, we're going to ask you to hold off on your questions for Dr. Hutchinson until we get to the second half of that panel discussion. So we'll do the talk, then a break, and then an opportunity both for questions from the panelists and also for questions from all of you. Now that's it for housekeeping. So next up, I have the privilege of introducing our keynote speaker for today, Dr. Hassan Hutchinson. Until recently, and for the past decade, Dr. Hutchinson was Director General of the Office of Nutrition Policy and Promotion of Health Canada, which is the focal point for public health nutrition within the federal government. The office's main functions encompass dietary guidance, food and nutrition surveillance, research and data analysis, health promotion, and public health nutrition policy. Recent initiatives included the development and implementation of Canada's healthy eating strategy, policy development for restricting advertising to children, and of course the new food guide. And Dr. Hutchinson was also Health Canada's representative to the Director General Planning Group, developing the whole of government food policy for Canada. In addition to all of that, Dr. Hutchinson served as co-chair of Canada's Dietary Reference Intake Steering Committee and of the Federal Provincial Territorial Group on Nutrition. He was on a number of nutrition-related committees at the World Health Organization, as well as the World Cancer Research Fund International, and he's also served on health-related committees at the Pan American Health Organization, the Organization for Economic Cooperation and Development, and at the United Nations. And he also served as the chair of the multi-stakeholder working group, which produced the sodium reduction strategy for Canada, and of the multi-sectoral network on healthy eating. Before all of this, Dr. Hutchinson was Associate Director of the Institute of Nutrition, Metabolism, and Diabetes at the Canadian Institutes of Health Research, or CIHR. And before joining the public service, Dr. Hutchinson was faculty member in the Department of Neurology and Neurosurgery at McGill University. So please join me in welcoming Dr. Hutchinson.
Thank you, wonderful. Am I on? Okay. Lovely to be here. I like my latest association here now. It's been 4 months since well, not quite 4 months since I retired, but since I've been out of the office, so it's been a different sort of a lifestyle. I think this is the first time that I haven't been wearing Lululemon tops or my trail running shoes and stuff. It's great. One thing I do have to point out is that since I'm not a Government of Canada employee anymore, I am not representing the Government of Canada by any of my comments as well. And I also am a little bit restricted as an executive, former executive from the government, of talking about sort of behind the scenes issues, which I usually love talking about. But in a year's time, I can come back and we can get into the dirt behind all this. So anyway, so I'll dive in. And we do have a new food guide. Everyone's aware we have a new food guide. I assume we got pretty good pick up on that sort of thing. So I'll run through a few things. But the other thing that, so this is what I'm thinking though, is the food guide itself really can't exist in isolation. It's part of a whole bunch of other policies, other strategies, other things that we have going out, what we had going out of the federal government as well. So I'm going to give a very quick overview of our more overarching health eating strategy that's part of Health Canada, that's sort of developed by my team there. Talk about the development of the food guide, spend a fair amount of time on that. Talk about the food policy for Canada, which I think a lot of people aren't really aware that we actually have a food policy for Canada that launched in June 17th, I think, of this particular year as well. And then we've been talking, sort of leading into this, is how does this sort of relate to sustainability, and then sort of what came out of the Eat Lancet Healthy Diet work that was released about a week before that we released the food guide as well, and has had a fair amount of pickup across the world. And so I'll reflect a little bit on that. Again, definitely not part of government of Canada when I'm talking about that. That's their stuff, not my stuff at all. So the other thing, we were talking beforehand, we were talking about how do we actually develop policy sometimes in Canada and what are the opportunities that are there. And what's coming up this week, actually, is we're going to have an announcement of new ministers. Should be on, is it Wednesday? I think the 20th is the date when the ministers get announced. And what happens when you have a new minister, or a new government in Canada, is that you have these mandate letters where the ministers have said, thou shalt, from the Prime Minister to the Minister saying, thou shalt do these particular things. So what happened 4 years ago to this week, basically, was that the mandate letters had in them, for the first time really ever, there were some mandates, direction to do with nutrition and healthy eating, which was kind of a rare opportunity to be out. And it is sort of then we went to the Minister of Health. We talked about restricting marketing of unhealthy kids, tougher regulations for trans fats, salt, improving food labelings, working with Indigenous and Northern Affairs on Nutrition North. The Minister of Agriculture got this direction to put together a food policy for Canada. We had the Minister of Environment and Climate Change got direction to put together a waste reduction, food waste reduction strategy. You had the Minister of Employment and Social Development Canada that got direction to put together a poverty reduction scheme. Well, all of these things are kind of really interesting and gave us a sort of a window of opportunity to do something in the policy world that we never really had before. So all my time in government was not sort of, well, go forth and really be creative in what you put together in terms of work on public health nutrition. So what we did on our Health Canada side is we put together this health eating strategy. And the idea here is we didn't want to deal with these directions that the minister got as just individual files and work on them separately. We wanted to sort of put together a comprehensive strategy where we're looking at the types of different policies, looking at the types of the different tools that we have for policies, whether they're regulation, education, whether they're standards, whether they're bans. How do you work with that so that you sort of reinforce using all of those different types of levers to change the healthy eating environment for Canadians? And so for the first time, we actually have sort of a comprehensive healthy eating strategy, number of areas that are nutrition information, food quality, protecting vulnerable populations, supporting nutrition education as well in there, with a number of the different files. So this was really quite exciting because what it does is it forces you to work with people who have different areas of expertise in terms of developing different policy approaches to really reinforce each other in what we're doing. And of course, we want to link it up with, as we referred to, the food policy for Canada as well. So it's sort of one major component of food policy. So that was really kind of an opportunity we'd never had before. We sort of grabbed it and ran really fast. In government terms, we went at really at the speed of light for what we did here. In the last few years, and of course, we've changed nutrition labeling has been updated, and regulations are in place. We've banned industrial trans fats. We've been trying to do something about industrial trans fats since really about 2007, 2008. And now we're in Canada, we're one of the 5 countries in the world where they are banned. And that's since a year ago, September, on that particular one. And of course, the new food guide, which was part of our health eating strategy as well. We've got quite a different food guide, as you're probably all aware, but we'll talk a little bit more about that as we go through. There are other things that we didn't quite finish up in this last mandate before the election. Front of pack labeling, we have did a lot of work on front of pack. We did the draft regulations, and we've gotten all the input on that, and there are, hopefully that will go forward. Marketing to kids, we've developed all the policy on that. It had gone through the different readings of the bills and just did not get through the Senate because of a bit of a blockage by one particular senator before Parliament got dissolved. So I'm not quite sure, as I said, what's going on going forward on this. I am hoping that this government will stay committed to those particular initiatives and we can sort of finish up these and then continue on with other things that I know were in the works. So I'll move in now to the food guide section. and here a little bit of a background. Of course, why is health eating information important? Why does it matter at all? And of course, one of the main things, of course, it is really one of the primary risk factors for burden of disease in Canada. It's really right up there with tobacco. And that's true not just in Canada, around the world. Actually, if you look at the global burden of disease, unhealthy eating has a higher burden than tobacco smoking does as well. But it is really one of the main things up there. The other thing is that it is seen as being complex because you get so many different interpretations of what the recommendations would be in nutrition information, and the next one talks about this. It's confusing. We're bombarded with different types of messages about that. We know that you've got our group folks who will give us all sorts of information. So you've got the celebrities giving us information. You've got different sort of professional groups will say giving us information, and you've even got, even when you think about docs, some docs sort of are very much in line with what we say. There are other docs that are really pushing very strongly a ketogenic diet, for which is not exactly in line with what we're talking about either, but you get, for the public, it becomes really confusing about what sorts of advice you want to follow, which direction you want to go with respect to healthy eating. And so what we tried to do here is to create a credible source of information where what we can present for Canadians is that, we have looked at the evidence that's out there, we've come to a bottom line that this is the best evidence where we are right now, at least with respect to understanding what's going on in the evidence base. The credibility was something that we had been attacked for in Health Canada before. With the 2007 food guide, there was a fair amount of, let's say, discussion that we were overly affected by industry with respect to how the 2007 food guide came forward. So we wanted to make sure that we were controlling for that when we did this food guide so that people could see us as being a very credible source. And so I'll mention different things that we have done as we go through the talk. Why does it matter? Well, the food guide is not just something that you sort of put up on your fridge. It is really a policy document. I mean, that's almost what the most important thing about it is, because it gets incorporated into different sorts of government regulation, almost to the point of regulations in some of the provinces and territories in terms of how they enact the food guide with respect to what is being made available in schools, in long-term care, in your hospitals and stuff like that. So it is really at the core of most nutrition information policies and programs across the country. Of course, it's taught in schools, and it influences what you actually find in the marketplace. Well, we hope it influences positively what you find in the marketplace as well. Why revise? Well, there were certainly, from a lot of the research we did about 5 years ago in preparing for this, we saw that people were having trouble really using the old food guide. The old food guide, a 6-pager, tried to be a promotion piece for Canadians. It tried to be a policy document, and it also tried to be a document that would be used for professionals who were trying to put together sort of the more technical side of putting together menus in hospitals, long-term care things. So it had 3 different sorts of functions that tried to be covered by one 6-pager. We know that was problematic. People were saying that they had trouble then applying it in their everyday life. They found the prescriptiveness about so many servings of different sorts of food groups to be kind of difficult and hard to relate to, especially from different types of ethnic groups that we have in country. The diversity we have in Canada is beyond that. And then, this bit about providing the right information to the right audience. So you have policymakers and health professionals want to have a depth of information that might not be best suited when you're talking to Canadians about sort of how to incorporate this into their life as well. So we wanted to really make sure that we're producing the types of materials that can be used by everyone. And we need different types of materials for different sorts of people. We wanted to, of course, get caught up on the evidence base. And here, certainly with respect to sodium, saturated fat, and sugars, which seem to be the 3 nutrients of public health concern that keep coming up all the time, for which there's lots of discussion going on out there. And of course, the other thing that's not on this particular slide, perhaps it's later on, is that what we did in 2007 in terms of having a 6-pager that you stick up. I mean, that was high technology back in 2007. You have to remember, 2007 was the year that the iPhone came out, and sort of revolutionized how we find out information. So we were in a completely different technological age in terms of how you assess your information. We had to get up to date on that as well. The evidence, said we started right at the very beginning in terms of how do you actually go out and assess what do we know about evidence that's out there. Because as you all know, you can go, for any topic really, you can go and find individual studies and make any story basically that you want to make by being selective and looking at individual studies. And in nutrition, I mean, there are hundreds of articles coming out every month. You can really say anything. So how do you decide which are the papers and stuff that you really want to follow as your basis? So what we had to do, we devised was a different sort of an approach, a systematic approach to looking at the information that was out there, looking at systematic reviews, focusing on the scientific basis, the relevance, the use of existing guidance, and work that we have done along those lines. So what we did to get there, of course, is to look at the scientific reports where they are from respected organizations like the World Health Organization, like the World Cancer Research Fund International, like the FAO, a number of them like that, where you are having a look at what we say the totality of the evidence. You're looking at large systematic reviews, meta-analyses, and what we were looking at specifically were papers, were reports where you actually had a panel of academics who were evaluating the strength of that evidence as well, and grading it. So we looked for graded evidence, and we published it as well. So part of this is again making sure that people are understanding that you can trust what we're doing. We've had two quite large reports that have come out on that. The first one we put out in 2015, and then we updated it up until the end of 2018 and launched that when we launched the food guide just earlier this year as well. So again, bringing everything up to date, basing it on what are these large, comprehensive, systematic reviews where we hope that what we're reflecting then is really the totality of the evidence going forward. And when we talk about our convincing conclusions, then what we have got then are looking at associations between whether it's nutrients or different types of foods and health outcomes, where there is a strong association. When you think of graded evidence, you've got strong, you've got probable, you've got possible or no association. What we used almost exclusively for developing our policies were where we had strong convincing evidence. If we didn't have strong convincing evidence, then we were really careful in terms of what we said. I mean, sometimes you use that as well, but one has to be really very clear what type of evidence you're using as you're going forward. But at the bottom here, of course, is that during the development of our evidence base, we did not look at industry commissioned reports, and because we wanted to make sure that there wasn't any conflict of interest that was in there. We know that, and probably many of you would know as well, when you do the analysis of evidence of papers that are being funded by industry versus ones that are being funded by NIH or CIHR and NRC, that you often get differences of what the conclusions are as well, so you control for that. And of course, what you come out of this for is that there is very strong evidence, clear that reducing consumption of foods that are high in salt, sugar, and saturated fat would be directly address the burden of disease. It's got moved around, as you said earlier on. But what we have, of course, here is that this is really, when you look at the evidence, there's really a strong need to make changes with respect to what we are eating, what's being part of our food supply, to address chronic disease. So then the way we run it, as I said, we do the evidence review. We use that then, this evidence, to then put together our dietary guidelines for health professionals and policymakers. So that's a document. I got my hat, my props. Even though we're going electronic, I still like to have hard talking things around. So then we do this with policymakers. Well, this is a 60-page document. We never had anything like this in Canada before. The Americans, of course, have dietary guidelines for Americans, a similar sort of an approach as well. a different sort of target group, we'll say, almost there. Which then becomes sort of, this is really where the policy is, right? This is the health eating policy is up here. And then what we do is we use that then to produce our health eating resources for Canadians. So they are all linked, right? So whatever you find, they sort of fall from one to the other. And certainly what we continue to do from an evidence perspective is that the gang still is looking at the evidence, you know, week by week, and I know I used to get reports every week in terms of what was published that week, and what we're looking at is there a need ever from the most recent evidence to change something with respect to our guidelines, which would then say we change something there. So it's not you know, the old way you revise your food guide and then 10 years later you go back and look at things. Well, this is on a week by week basis. They're looking at the evidence that's coming in, and there's a commitment that's being made, and a commitment by the minister. I guess it's still the minister we have for at least another 2 days, that if there's a change in the evidence, we'll look at what sort of changes have to happen for the policy, and then what changes have to happen with respect to information to consumers. So it's much more of a living thing than it used to be before. And it helps, of course, that everything can be electronic, so it's much easier to get in there and make the changes. So engagement was really important as well, of course. So you got your very strong evidence base to start with. But then we did lots and lots of engagement with different sorts of folks to make sure that the material we were putting forward really communicated the guidance accurately, was correct, or we weren't missing things. And so we had a large number of academics who were involved in different stages of this, whether it was to help us with putting together the evidence reviews, whether it was to be part of the body that looked over the dietary guidelines for health professionals, whether it was looking at the materials for consumers as well. So a large number of different types of groups. What is important here, well, it's all important that we're dealing with all of these, but one thing to keep in mind, of course, in a country like Canada, we at the federal level are only have responsibilities to a certain area, but then when we talk about nutrition, well, so many things, but when we talk about nutrition, once you step over in the provincial and territorial territory, that's something that we as feds can't really do. You can sort of put your toes into federal, provincial responsibility, and there can be a little bit of an uprising. We see that all the time, I suppose. So when you're putting together the food guide has to be, even though it's developed by us as the feds, it has to be a food guide that is seen to be for all Canadians. So what we did is we did a lot of consultation with the provinces and territories. We met with them about once a month for about 2.5 years, and sort of step by step to make sure that what we were creating would be able to be used at the provincial and territorial level, which then, implementation in so many domains is in their area of responsibility, not in my area of responsibility. We also worked with professional regulatory bodies. We worked with different health charities as well. I think about 16 or 18 different groups that we met with, at least on a quarterly basis, for the very same reason, because this food guide had to be something that then became the basis for their programs that they do with respect to nutrition and healthy eating. And then by doing that, of course, what you get is a little bit more consistency in what reaches Canadians as well, because what we really want is them to get similar sorts of information coming from their doc, from their dietitian, from their provincial government, from the feds, from the heart and stroke, so that there's a consistency in information and messaging instead of having people give different types of messaging. So we did a lot of work to ensure that we could get as much of that as possible. Openness and transparency. Again, in the past we've been criticized about having backroom meetings, especially with industry. So in terms of sort of the policies of how we put these things together, we had working policies where any sort of submission that we got as part of our big online consultations, and we had about 27,000 Canadians over 2 consultations give us advice. Everything that we received there, and that was completely open. So there, industry could put in their advice to these big, large consultations, as could, of course, all of the health groups, could the academics, could the provinces and territories. And we published all of that, and really the Canadians see as much of it, see everything I saw, that my group saw. So we didn't hide anything back. We made sure that that is out there in the open for people to see. with respect to meetings, any meeting that we have about not just the food guide, but about any aspect of the healthy eating strategy, you can go online and say that, you know, on September 16th of 2016, December by then we have in place the policy, that you know, Hassan Hutchinson met with representatives from Diabetes Canada, and they discussed this, and this was the deck that was shared back and forth. Do you want to see the deck? Just ask for it and we'll send it to you, sort of thing. So we did that. We've done that for everything we've done in the healthy eating strategy, right up to the deputy minister. You know, so if the deputy minister had a meeting, it's registered in there as well. I'm registered in there. Everyone, you see it. So there's no hiding of any sort of exchange that happened there. Additionally, of course, for the Office of Nutrition Policy and Promotion, we did not have any meetings with commercial interests in that whole time period. And as far as I know, they're not doing that now either, just to keep that distance again. And you know, once again, to really make sure that we're building back the confidence of Canadians in terms of the information we put forward. We wanted to make sure that the information is relevant and useful, so lots of public opinion research. We put a health literacy lens on everything we did. We tested with quite a diversity of different type of peoples, and we always took into consideration determinants of health, cultural diversity, social context, and put a fair amount of work into looking at the context of Indigenous people. So, you know, in here, you've got a section about the effect of residential schools and sort of and what that did really to block the transmission of practices between generation and generation, and how that's affected the communities and the peoples and their culture, sort of thing. So those sorts of things, we've never done that sort of thing. So try and speed up a little bit here. So I think those processes that we put in place, we tried to once again reinforce this to build up confidence in Canadians that we are doing our job properly, effectively, and we're not being affected adversely by where there's conflict of interest or sort of commercial interests that are there. The new food guide, as I mentioned, we tried, it's a whole suite of different sorts of materials and resources that were there. We heard very strongly from Canadians that they wanted to really have actionable advice to make it easier to them to apply it on their day-to-day life. The updated recommendations on these nutrients of public health inserted there, and of course we've got this very mobile responsive web content, which makes it easy for anybody to get in there and find the type of information they want at the level that they want it as well. So it sort of comes out here, and what we launched back in January were the dietary guidelines, this baby here. The snapshot, which is sort of taking this, and this is just a snapshot version of all the information that we're putting out to consumers, as well as videos and recipes and actionable advice on the website, and of course our evidence reviews. So it's not just something you post up on your, once again, not something you just put up on your refrigerator. It's a whole collection of different sorts of resources that are sort of mutually reinforcing each other. I'll run through very quickly what's in the policy piece here. It really is sort of based on 4 different chapters here. The first is on nutrition foods that are the foundation. So, things that we want you to eat. There's a section on things we don't want you to eat, or sort of cut back on at least. So that's eat and not eat. But then it's really important as well to move beyond just what you eat and what you don't eat, and we have to look at how do you make that real. So we have to be aware of food skills and what sorts of things do you have to put into place that can better develop food skills to support healthy eating as well. And once again, there are suggestions and recommendations and considerations along those lines. And the 4th main chapter there has to do with supportive environments for healthy eating. So this is really where what we're talking about here is that we have to take in social determinants of health. You have to think about health inequities, food insecurity. This goes far beyond the food guide per se, and it's a little bit of a call for action for other folks in other parts of the federal government, for other governments as well, for municipalities, to really see that if we're going to do something about creating better food environments, we actually have to be working together across all these different groups to have an effect. So, guideline 1's about this foundation for healthy eating, basically having lots of fruits, vegetables, whole grains regularly, and little bit of a reaction here among protein foods to consume plant-based more often. Say that the dairy industry didn't like me very much because of that, and more of the parts of the meat industry on that. And of course, what's in this document is, why do we say that? And sort of what are the different lines of evidence that push us to go in that direction? So it's really sort of upfront in terms of why are we saying that, why we believe there's strong convincing evidence to push us in that particular direction. And with the EAT Lancet report, they're basically saying exactly the same thing, and we'll see their plate later on as well. Very much in line with what the EAT Lancet report came up with. A completely separate group of 37 experts from around the world coming up with really the same sorts of sets of recommendations. About fats, because fats, this is something, there was a lot of confusion out there with respect to saturated fats and unsaturated fats. Based on the best evidence right now, there's strong convincing evidence that you should be eating mostly unsaturated fats and replacing foods that contain mostly saturated fats. That is as true now as it was when we released it. I mean, recently, about 3 months ago, the UK Science Advisory Committee on Nutrition put out, how big is that? You've seen that book? I can't remember. Which one? The Science Advisory Committee on Nutrition on Saturated Fat. I mean, it's hundreds of pages long. Same interpretation we have as well. One thing to keep in mind, we're not saying low fat, and certainly the way the old food guide read, it seemed to be coming across, it's just low fat is best. We're not saying that at all. It's not about total fats being reduced. It's about a switch from saturated fats to, or maybe more unsaturated fats. It's not a low fat diet. Water was something that we really emphasized very strongly before. We thought from a public health perspective it was really important to put water front and center. Here we know that there's incredible consumption of sugars by the different types of drinks that are out there. We wanted to hit that. I'll sort of do that too.
I can get it for you.
And so with our guidelines in here, there are sections as well in Guideline 1 that talks about different sorts of considerations. So I plot this one in there in terms of considerations. It has, thank you very much, had to do with environmental impacts. We did look very closely at the evidence for sustainability. We actually contracted with folks here at the University of BC to have 2 big studies that were scanning the literature about whether we would, and we did this back about 2016, I think it was, about whether we could actually incorporate sustainability as drivers in terms of how you put together your healthy eating pattern. But what we found is that at this particular point, we didn't really have the right type of evidence that was there. I mean, in terms of, say, carbon footprints of different types of foods, we have some pretty good databases in Ontario. We have pretty good databases here in the Lower Mainland, but for the rest of the country, there's basically nothing out there. And we have to try and do something across the country. And you know that the carbon footprint is going to be different in Nunavut than it is here. So it's not something that we could really build into sort of for the whole country as well. But what we realized at the end of it all, as we sort of went through and came up with our recommendations that are based on evidence about health, is that our recommendations actually really sort of go in the same direction with respect to the environment as well. And so basically following our food guide, it really takes you down a path where you're actually supporting to a lesser environmental impact, because patterns of eating that are higher in plant-based foods have less environmental impact generally than animal-based foods as well. Generally, I will say. So this is very much in line with what the EAT Lancet report came out with as well. But we didn't use this as a driver for producing our pattern, and we didn't really think we had to because it sort of came up with the same sort of recommendations anyway. Food and beverages that undermine healthy eating. Here, of course, is what we're talking about, the processed and prepared foods that are high in these nutrients of public health concern, like the saturated fats and the sugars and the sodium as well. And we know that those are just rampant in terms of what Canadians are eating right now. And so this is something that we really have to try and move on to change that sort of eating patterns with all the highly processed foods. It's not exactly an ultra-processed foods like what the Brazilians and then there are other folks in Canada as well who have been analyzing our consumption patterns. really big overlap though. I mean, I've talked a lot with my colleagues in Brazil about sort of their analysis and our analysis on this. And there's probably, I mean, well over 90% congruence with what they're saying to advise to ultra-process. Where I have problems with ultra-process, I think probably eventually we'll be able to use the ultra-process terminology, but when I look at the evidence, I don't see any strong convincing evidence at this point. Maybe in 5 years, maybe in 10 years, there'll be strong evidence for ultra-process, but I don't see that there. But where there is strong convincing evidence are processed foods that are high in sodium, sugars, and saturated fats. So that's why we went with that particular definition there. Considerations, once again, considerations in this chapter here, I think we just highlighted alcohol consumption. Basically, the bottom line is if you don't drink, don't start, is really what it comes down to. And then if you do, really to follow the I don't know, it's not called healthy drinking. We don't call it healthy drinking, but you know, but in terms of the low amounts that are coming in, you are going to do that. And well, there are, and this is sort of funny because alcohol does sort of have, there is some strong convincing evidence for beneficial effects with respect to cardiovascular, but there's very, very, very strong convincing evidence with respect to cancer about it being deleterious. Certainly, we went that line. And of course, you've got incredible social costs with respect to alcohol as well that are on there. This is really important, this other consideration here, and it's basically, you know, food and beverages that are offered in publicly funded institutions to align with the dietary guidelines. And this again, as I said, you know, we as feds don't have an awful lot of jurisdiction over hospitals, over recreation centers, over schools, over long-term care. And so it's a little bit of a, hopefully that, you know, other levels of government would then say, well, you know, we can do something here as well. Because it's not, just giving guidance is not going to do it. You really have to change the environment, the food environment. And actually there was just something that came out of JAMA, it's the 28th of October, looking at, I want to say, San Francisco, University of San Francisco, who got rid of the sugar-sweet beverages. They followed what was happening with respect to consumption of sugar-sweet beverages, dropped a lot, measures of effect on insulin resistance improved. I go up or down, I don't remember the particular standard there. And as well, there were some suggestions, after years worth of intervention there were some suggestions that there was some difference in girth as well. So, you know, so it's not that we were telling people to do that, we just took away the choice on the campus of that choice, and you saw those changes. Those sorts of policies and programs really have to be enacted. Again, not areas that we as the federal government, which I'm not part of, can go into it as well, but it's really bringing that apart. We're not going to have an effect by me preaching about what people should be. We have to change the policies across the country with respect to what is available and, you know, how food is produced. And, you know, that is very fundamental. You know, it's important to know what from recommendations of what you should be eating, but you have to be able to enact it and change it using different sorts of policy levers. The food skills, we know that transference of skills has dropped off. Some of it perhaps caused by the federal government in the past with respect to indigenous peoples at the residential schools, but also it's just not there as much in general from the research that's been done. Research here is not quite as strong as the other areas. I have to point that out here. There are some systematic reviews, but there aren't lots and lots and lots of them where you have a group of experts review it. So you just, I mean, it's common sense perhaps, but at the same time, there is some work that has to be done here. What we do know is those points that are checked off. So food skills is really important. Food skills as well as sort of how to cook and how to put meals together and understand how to do shopping and stuff. And, you know, food labels is one that we have tried to change as well, our food labels, and both with respect to revising the labels that are there now, and there have been some preparation over the last several years in terms of front of pack labels that would point out when foods are high in sodium, high in saturated fat, or high in sugars as well. Once again, that's not gotten to the final prorogation of the final regulations, but hopefully that will come in the future, out of my control completely. And then we've really already talked about this, the implementation of dietary guidelines. We really have to be thinking in terms of health equity issues here. very fundamentally, and to make sure that these things are incorporated over the different sorts of bodies that have control over them, provincial jurisdictions, municipal jurisdictions, different sorts of bodies as well. So that was sort of what was out for the health professionals, and what we have for Canadians, and I will go through this very quickly because it's similar stuff, but just done in a form that should resonate with Canadians. And we did lots of public opinion research on this, asking people. This was sort of what we created as our snapshot there, that would sort of be the thing you put on your fridge to remind you of things. What I find really important here is that, seeing what to eat, what not to eat sort of is here, but then this other side of the how to eat sort of thing, and certainly Minister Philpott, when she was my boss, really loved this sort of switch of emphasis in terms of, it's not just about what to eat and what not to eat, but it's all about that how you're going to be mindful of eating habits, cooking more often, those sorts of factors as well as being really important. So what we have here is it provides this really simplified way, and this is sort of, we tried to decide here. The proportionality here, how do you get the basic messages that you want to get across? We went away, as I said before, from saying so many servings at a particular size that nobody really liked to follow at all. And here, making half your plate fruits and vegetables. I mean, you get the concepts when you look at it. Your proteins, being a mix of different sorts of proteins here. We're not hitting them over the head, not to eat meat. You've got animal products here as well, but it's a mixture of things, and they're all really good choices, and you can use, there's fish in there are beans in there's tofu in there, there's dairy in there. There is dairy in there. I'll say the third time, there is dairy in there in the food guide, and if you go into certain policies and the materials for consumers as well, there is no slagging of dairy. We just haven't sort of put it up as, well, we're not using a food group sort of an approach. It's not those consumable sort of approach. But we also felt that the water, as a public health statement, having the water there was really important because of what we see in terms of consumption patterns, especially with respect to adolescents, especially young men specifically, but men seem to continue that out into their lifetime as well. But just get back to drinking water, and that's really what we thought was necessary to have a very strong public health message about water. And when we tried testing it, where you had two choices of beverages there, which we did that, you lost the concept of the water, got lost in it all. We went with a simple message, And it works well, and I think I might have mentioned this when I was over across the street in May, but maybe it even works too well, because soon after we launched this, I was in the kitchen with my daughter, and we're having a glass of wine. My granddaughter walks in, and she looks at both of us, looks at the bottle of wine, looks back up, and said, Grandpa, at school they told us that the beverage of choice is water. So I got caught with that within 2 weeks, and not because I was saying anything to my granddaughter, but because it had sort of been caught already in the schools, and we've seen that. I mean, the amount of letters and cards that sort of came in talking about how the uptake was at schools was fascinating. It was just sort of like overnight. Kids were aware of this sort of thing to the point of them getting in trouble. We took, of course, these things were not randomly put up there. We sometimes get accused of that to a certain degree. We wanted to make sure that a range of cultures were there, of course, aligned with our dietary guidelines, relevant to Indigenous peoples, commonly produced in Canada, and that they're not expensive things. I mean, the first thing we got in terms of criticism, well, that looks like a really expensive plate. Well, as it turns out, the University of Dalhousie, and you say, well, did the analysis of the plate, it's actually a cheaper plate than the old food guide, which they didn't like because Charlevoix, if you know Charlevoix Ragans, he likes to slag us all the time, and all of a sudden he couldn't say that it was more expensive, but it's not, So we tried to take a lot of considerations. And with respect to Indigenous peoples, we had a group of 26 or 27 different Indigenous health professionals or health professionals who worked with Indigenous, who looked at every piece of paper that we prepared with respect to these sorts of images and stuff, and gave us feedback that it's not that this is an Indigenous food guide, but at least it wasn't going to raise any flags with Indigenous peoples as well. So we took that in consideration as we went forward. So what we tried to convey here, because we have a very, very rich culture in Canada of different sorts of peoples, so that people could see themselves in it as much as possible. It's hard to do with one plate to do that, but as much as possible to do that. But then when you get into the rest of the food guide and what we have online, it becomes pretty obvious as well what we're doing. So the messages, I'm not going to spend any time because they just sort of parrot what you already saw with respect to the policy pieces. But these slides will be available. But so basically the messages at the level of the consumer. This one about drinking water. Make water, replace sugar drinks with water. Oh, look at that! You can have other out there. You can include low-fat white milk. Plant-based beverages, coffee, tea. So it's there as well. So this is again the interpretation of not just the what to eat, what not to eat, but sort of the how to eat. We're talking about being mindful of eating habits, taking the time to eat, not being distracted, not sitting down in front of the screen and trying to eat food. Because you know that there are studies that show that when you're in front of a screen and you're distracted from everything, you eat more calories. I mean, that's really clear. And we want people to be able to it's because your body has to sort of react to what you're taking in. It's not instantaneous. And if you're watching something, you don't pay attention to what your body's saying, basically. Cooking more often, eating meals with others, enjoying your food. These things are very important considerations with respect to putting together healthy eating habits as well. Communicate. Let's move on a little bit. I've alluded to this already, that of course, what you see for consumers in terms of like a two-pager is just really the tip of the iceberg of what we produce. We've got tons and tons of other sort of web pages underneath that for all different sorts of topics there. And the food guide's all of this, right? It's not just the little two-pager that we produce. Online, you find all sorts of stuff. There's life stage guidances there for health professional. You've got the healthy term infants. You've got prenatal nutrition that's there. You've got stuff on eating protein foods that help Canadians then, what are protein foods? What do you get out of protein foods? What are some examples of protein foods? How do you prepare for protein foods? And this sort of scrolls on, online. Like the slide here, it links into recipes with protein foods about incorporating more plant-based proteins. Yes, again, this actionable advice that they're asking. As an example, protein foods. Of course, we have that for whole grains, and we've got that for fruits and vegetables. Some stuff, an example, another for seniors. So different life stages as well. We've got this is about shopping for 1 or 2, cooking for 1 or 2, eating with others, and how you can incorporate that into your life. We've got a lot of recipes on there, and everything sort of links together. So if you're in a particular section, at the bottom of a section, say about kids preparing meals for trying to encourage really teenage boys to. The video's about a teenage boy, but about creating your meal for school the next day. So you've got the information and sort of the tips to get there. We got a lovely video of this 13, 14-year-old boys who are putting together meals. We've got links to different sorts of recipes that can be used again. Again, the idea is that there's support for people to change their habits in the ways that they need. So that's sort of my quick breeze through the food guide side of things. Just a reminder that, of course, once again, the food guide isn't meant to do everything. It's sort of the core of what we know about healthy eating patterns with reference to really health equity being really important in my mind. And there are these other sorts of policy levers that we're trying to work together with and reinforce with to move the food environment for Canadians. So that's the food guide, healthy eating strategy. The food policy for Canada, I think we mentioned this up above, that the Minister of Agriculture 4 years ago was mandated to put together a food policy. There were 4 big areas in the food policy. One has to do with increasing access to affordable food. And in there, of course, we're dealing with food insecurity that's in there. Poverty reduction strategy was kind of developed under there. That was launched about 1.5 years ago, actually. I don't know if you're not aware of that. It's online. Poverty reduction strategy. Conserving our soil, water, and air. So the environmental aspects, the sustainability aspects of food, were looked at. And here, of course, you've got the commitment by Environment and Climate Change Canada towards food waste reduction in there. Improving health, our stuff, and food safety is part of that. and then growing more high-quality foods. And what do we have to do in terms and this has more to do with the agricultural sector, what sort of supports have to be in place moving towards more high-quality foods. I mean, one example of stuff that has happened over the past few years was, and it wasn't agriculture and it wasn't health, I think it was industry, which of course has this innovation and something in the industry Canada. I think they put about $240 million into a project where it's with other partners. I think they have a total of about $600 to $700 million to look at plant-based proteins, and this is based out of Alberta and Saskatchewan. Center of Excellence on Plant Protein or something like that. You know, so there has been some work already well underway in this particular area. We engaged, you know, I think I mentioned that we have 16 different sorts of groups across the government, because it's not as simple to say, well, put together a food policy. Well, that's not my responsibility, solely my responsibility. I've got a part of that. Or Health Canada has a part of that. Agriculture has a part of that. Fisheries has a part of that. You know, environment. So this has been really quite an interesting process, because this sort of policy development across a large number of different departments it can take a while, of course, but it's the type of work that has to happen when you've got topics like food that cut across so many people who have their responsibilities. So how do you actually cut apart those silos so you can be working together and sort of mutually reinforcing or taking into consideration the different types of evidence, and how do you put that together into an overarching scheme? We did, again, lots and lots of engagement. Actually, one of our engagements out in the West was just over here. It was my first time back on campus for a decade and a half, I think it was. Does the faculty have places you can?
When you came to visit us?
The alumni?
You came to Food Nutrition.
No, about a year and a half. Because the Alumni Center, a place where you meet and we have meetings. Yeah, I think that's where we did it there. So we met with all sorts of people with different backgrounds and food there. We went up to, we were up in Yellowknife. And actually, you know, I think the most important part about having a road show where you're out with the Minister of Agriculture across the country is the connections that then you make between the other Director Generals. So, you know, we were at a certain point, we were up in Yellowknife, and we were looking at the Northern Lights. So we were around a campfire with the Assistant Deputy Minister in Agriculture, who's responsible for the food policy, with the Director General, who's in charge of food waste reduction, with myself, with other people as well. And sometimes those connections and sort of that sort of breaking down the barriers happens around the campfire when you're watching the Northern Lights, and then you come back and you've shared sort of information, you get an appreciation for what they're doing. And then it's incredible the amount of exchange of different types of information that happened. I, of course, shared all this stuff that came out of the University of Oxford about looking at the effects of going more plant-based, effects both on the environment and effects on health as well. It was those sort of things. So we did lots and lots of engagement. I think there was, 43,000 people that took part in that online survey. I mentioned that we launched it on June 17th. And so we had already, of course, health eating strategy was launched by them, the poverty reduction strategy was launched by them, and in there what came out was the creation of a food policy advisory committee, so a multi-sectoral group that will be put together. This has not gone forward. I'm hoping that with the new government this will continue this sort of work. We did have the Government of Canada invest about $134 million out of the budget 2019, local food infrastructure, Northern Isolated Community Initiative, so really dealing with access and availability of foods in more remote areas. Buying Canadian promotion, reducing food waste, $26 million towards that particular program, and food fraud. And really quite importantly, I think, and an interesting step for a federal government to take here is to working with the provinces and territories and non-for-profits towards the creation of a national school food program. Because for forever, I've been having, I was saying in my old role, well, it's not my responsibility, it's the responsibility of the provinces and territories. But at a certain point, you have to have someone step up, and the government stepped up and said, okay, we're going to work with that. We realized that the provinces and territories are responsible. What can we do to sort of support that? So that was a really, I think, an important part of the food policy, which was just launched a few months ago. But again, we've been on hiatus for another few days as well, and hopefully these things will then continue to be involved. So that's sort of the Canadian hit. So you see it's quite a wide variety of things. It's not just the food guide, it's looking at different policies. We're working with different departments to try and change that food environment. Now I'm realizing it is 5 o'clock. I think I will go very, very quickly through this next series of slides. These aren't my slides. This is the Lancet slides. And I think you'll be able to see that things are presented in a slightly different way, but we actually are very close to what we're doing when you take into consideration what we're doing with the food policy for Canada and also for the health eating strategy, not just the food guide itself. So they have 2 types of targets. One has to do with healthy diets, and this is this group of 37 experts from around the world, from I think 16 different countries were represented, headed up by your old stomping grounds at Harvard with Walter Willett, I guess, was sort of one of the main people there, and other people from the Food Policy, Institute for Food Policy in London. Karina Hawkes was part of that. And so they came up with looking at whole grains, tubers, vegetables, fruits, dairy foods, different sort of protein sources. They talked about added fats. And then and so they sort of created targets and ranges and fit that into a model. And they come up with the plate thing. Oh, well, look at this. Half your plate, fruits and vegetables. About a quarter of your plate, what we call protein foods. Focus in the protein, very strongly on plant-based protein, which we're sort of making that sort of recognition. Whole grains, our whole grain section was a little bit bigger there. We didn't give saturated plant oils and added sugar sort of their own place. They sort of got built into the rest of it. Very similar thing. So it was kind of fun when you went out and saw them presenting. They present this plate, and then the very next plate would be our new food guide. And they'd say, look, a different group, somehow they came up with 37 people. I guess it's the 37 scientists that we got advice from, came up with, as they say, the same pattern, different people using different sort of methodology as well. But of course, all of this is based on the same evidence base that's out there. We're reading the same papers, reading the same systematic reviews. It shouldn't really come as a surprise because, as far as I'm concerned, there's strong, convincing evidence for what we used as the foundation for putting together our food guide. So I shouldn't be surprised that 37 other experts from around the world came to the same conclusions from the same basic evidence. The other thing that they looked, sort of that we call their target 2s, have to do with different parameters of sustainability. And for them, it had to do with climate, but we're talking about greenhouse gases, basically, not just, but greenhouse gases, nitrogen and phosphorus, effects on water supply, biodiversity, and your last. So they came up with another sort of set of parameters here, where if you're going to be moving towards sustainable food production, then what you're really trying to do is to eliminate the global impact of the food production on these sorts of different parameters as well. So different set, and this is all based on modeling work. Very clearly, again, we don't obviously have evidence that we've done this and this is what it shows, which is the type of evidence I look for being able to then support what I've done, what I put forward when you are forming policies in Canada across the world. But they've done, I think, a really brilliant job of looking at different things and organizing, the modeling work is really well done. It is modeling, it's not systematic reviews, and it's not those sorts of conclusions. And then they moved in, so they got the goal, of course, is to have healthy foods and to be able to feed how many million people by 2050, 10 million people by 2050. The 2 targets have to do with, the food pattern that you're having and the effect on different sustainability parameters, environmental parameters. And then the 5 strategies. So the 5 strategies they put forward is, to seek international and national commitment to shift towards healthy diets. Now, what they have an example here is that, municipal policies and actions, food production and distribution. Well, these sorts of parameters here, we have been dealing from a food guide perspective. We've, of course, been working to have agreements with the provinces and the territories and for the different groups in terms of taking our policies forward with respect to sort of what is it that you put forward for health eating. We've been having meetings with with hospitals and sort of what do they serve in their hospitals. So it's a similar sort of an approach. And of course, through our food policy for Canada, we've been looking at food production and distribution and what we can do to, say, for example, decrease food waste during the production cycle of foods, as well as what do you do to reduce food waste when you're dealing with individual Canadians as well, when the consumer is actually wasting. We've been looking at those sorts of things. Their second strategy had to do with reorienting agriculture policies from producing high quantities of food to producing healthy food. And so what they're looking at here is sort of the shifts that have to happen. So what's in the gold, I guess it is business as usual is what they mean here. Business as usual and full waste, just the waste that's going. And then what they say, we have the shifts that have to take place if you are taking into consideration the public health diet, as well as having the amount, reducing by half the amount of waste that's out there. And so you see shifts, whole grains actually comes down because, well, you'll see down here when you get the red meat, they're saying to go down in red meat, poultry stay the same, eggs come down, fish up, and then where you got an increase in proteins is really in the dried beans, lentils, peas, soy, and the nuts. Well, the soys and the nuts actually have a lot of water that gets used, so that's why sometimes you don't see the shifts that way. But very similar to the types of shifts that we think have to happen. Again, we have not said that. I'm not saying that as a representative of the government of Canada as well, but that's what's sort of behind what we're putting forward. And of course, we've been talking about this. I can't say this. When the food policy for Canada was reviewed by the Standing Committee on Agriculture and Agri-Food, they tried to slag us, the food guide and the senators tried to slag us by saying that you guys should be meeting with industry because you should take into consideration the commercial interests of industry when you're putting together the food guide, or that they should, the question was along those lines. And so we wrote back, and this is the Minister of Agriculture that signed off on this, and they're writing back, well, we agree that those should be brought together, but the way we see it is that the food guide actually presents the recommendations and the advice of where you want to move towards having a healthy food supply. And what the Department of Agriculture will do is to look at how it can mitigate and help that change and support industry to make the change towards healthy food supply. So that's right in the report signed off by the Minister of Agriculture about a year and a half ago. So it's that type of thing, right? We need to make changes, but what we have to do is to support the industry to make the changes in certain instances as well. So again, using different sorts of policies to move that bar. Strategy 3 is sustainably intensify food production to increase high quality output. Their bottom line here, it's a bit of a mess here, but the idea is that when you're putting together advances in agriculture, you have to take into consideration the effects on your ecosystem as well. It's a bit of a limitation with respect to increasing endlessly your agriculture and not sort of destroying your ecosystems is what they're saying here. Strong coordinated governance of lands and oceans. They're basically saying you have to, this is sort of the mix the way it is, and we have to keep this type of mix. So the idea is that you don't want to sort of destroy your resources for the ecosystem, for plants and different animals. So their example here that they showed, which is kind of, your produce changes with bees when your produce choices when you've got bees, and basically, but this is your choice when you don't have bees. So basically what they're saying is you have to take into account the effect on your ecosystem when you're planning your production of agriculture, because you don't want to wipe out the bees, because this is what it does to you as well. So it's not just about the agriculture and producing the particular crop. You have to take the whole ecosystem into place when you are moving forward and figuring out how you go forward with agriculture. And this is at least half food losses and waste in line with UN Sustainable Development Goals. We have a section in the food guide, and it's certainly in our food skills about decreasing waste. We're working with our colleagues over in environment and climate change as they're putting together their approach about what do we do, and we're sort of thinking, we have been talking, when I used to work for the government, about how you can actually come at this together, and perhaps when you get out in promotion campaigns, we actually bring in sort of the environmental perspective on food waste as well as the health perspective on food waste. In some ways, I think, if you're trying to make change with kids in schools, the way you can rope them in is not probably about what their health will be like in 30 years, but when you link it to the environment, I think then you can actually get kids to really be part of that as well. And that's sort of some of the discussions we were having with environment and climate change about how can we come at the food waste in working together on that. And again, a direct result of the food policy for Canada work that we've been doing and the campfires that we had. So that's, here's, and this is again, Eat Lancet. This is what they're trying to do, of course, is to feed 10 billion people a healthy diet within safe and all planetary boundaries. So there is where I'm leaving it. Sorry. You do very well on your timing.
We have plenty of time. So thank you so much for that interesting and engaging talk. I, for one, am grateful to hear that coffee is not inconsistent with a healthy diet, so with some low-fat milk, perhaps no sugar. Right, so I think let's still take our quick 5-minute break and then we'll go right to the panel. So let's all try to be back, if you're able to stay for the panel at 5:15. Thank you again. I'll let put them.
Yeah.
I'm just going to put the table. And then they turn I was just going to say
Yeah. The interesting part here is that we really started as working since Canada, surveys, and sound. Food guide or not. Food skills, we had 2 big representative samples back in 2013, 2014, looking at food skills, food skills, we updated all of our environments starting in 2010.
Just the films because turned off at 5.
I mean, there are a lot of other countries that are trying to do similar things. What happens from a government perspective so often is that the silos really make it hard to move forward, especially when my responsibility is nutrition. My responsibility is not the environment. My responsibility is not.
Friday of last week, just last Friday, the setup that I was supposed to
And what happened in the last 26 days is that we had a whole section on sustainability, and that was when
keep it on your radar. Likely to see black Facebook standard.
So Americans and we meet with them. Ventures together with national academies. All of our work, for instance, to do with what are dietary intake levels and stuff. Pool our money, or their money than my money, and put it together. I would say that the Americans that you have in place are brilliant.
Oh yeah,
But
great.
they're constrained by the system. And the other thing you have with the states, of course, is in bureaucracy.
I'm going to come in and because it's perspective.
None of that happens. Political parties are everywhere. That really affects what you can do because you get direction from the and that's where the sustainability, the environmental side, what happened in the states. With us, the Americans were really good job. A lot of the stuff that we done on Americans, but when we had our suggestions, and the minister's office, the prime minister's office, we had these I know it tricky about reality. Because we're able to walk in with the evidence they never force us to do anything that against the evidence. Now, you're conservative. Yes, it started out.
Do you want to flag me down?
I will, yeah. But well, I wasn't at Health Canada, but I was was this favorite institute. I was on one. I didn't see an awful lot of evidence. But at the time, of course, we all sort of need to build this unnecessary. Whereas if you look at what happens here, most people are really don't think that. Not all the time.
That's the best way pick an order of the cautionary notice. I think first it's supposed to be speakers and then first.
The political side.
I'm already.
Because you're last. Everyone's going to be tired of my voice by the end of this one. Yeah.
It's good.
I did, yeah, actually, I don't know what's going on.
I responded to them.
And actually, I chaired a whole board. And so I get my spiel to all of them. And of course, a lot of them are pretty much the work. I bring it together as sort of an overarching pattern, sort of like the reckoning possibly other they're not there yet. So I have presented that to WHO and to WHO Central. Recognize some of that?
Yes. Oh,
Ready? And it's on mute. Okay. All right. That was quick. Thank you for coming back. So we'll
Quicker than my talk.
but not as interesting. So we'll turn to our panel discussion now. So what we're gonna do is, actually let me just first tell you who's on the panel. Of course, we have Dr. Hutchinson. We also have sitting next to me, Rachel Murphy, who's an assistant professor here at SPPH. In the middle, we have Mazza Jesri, who's an assistant professor in the Department of Food, Nutrition, and Health in the Faculty of Land and Food Systems. And then Naveen Ramankutty is a professor and also the Canada Research Chair in Global Environmental Change and Food Security at the School of Public Policy and Global Affairs, and also the Institute for Resources, Environment, and Sustainability. So that's the very brief intro to the panel. If you don't remember me, I'm Kate Weinberger. You'll hear from me a little bit. And I think what we'll do is start by asking each of our panelists to maybe introduce themselves a little more, talk about what your expertise is, take an opportunity to reflect on aspects of Dr. Hutchinson's talk that caught your interest, ask him a question if you'd like to, and then we'll see where we are on time and perhaps open it up to questions from the audience both here and online after that. So Naveen, is it okay if I start with you as the person who ended up closest to the other end?
I thought it went the other way.
Oh dear, sorry.
No worries. Is this on?
It's kind of sexist,
Is
isn't it, doing male.
So I don't work on health. I work on environmental sustainability. So I'm going to come to Hassan's talk after a preamble. So I came into this field being interested in environmental problems, and originally a climate scientist, and then I was working on ecosystem degradation issues, and quickly realized that human impacts on the land surface is one of the biggest causes of global environmental change. So agriculture today occupies about 40% of the world's land. It was in one of Hassan's slides. That's a huge footprint on the land by just one species and just for producing food. Right? And this has really major global environmental problems as well. We have lost about 30% of our forests to agriculture, and this results in greenhouse gas emissions, carbon dioxide emissions. So people have estimated that about a quarter of our climate change problem comes from agriculture. About 13% of carbon dioxide from deforestation, about a half of our methane emissions from enteric fermentation of animals, and as well as rice paddy cultivation, and nearly 3/4 of our nitrous oxide emissions, a very powerful greenhouse gas, from fertilizer use. Agriculture is also the biggest driver of biodiversity loss on the planet. So for birds, for which we have pretty good data, about 60% of the threats to birds comes from habitat fragmentation from agriculture. It's also responsible for about 84% of consumptive water use on the planet. So we talk about freshwater resources depleting, it's mainly because of irrigation. And nearly all of the kind of water pollution problems we have around the planet, especially the kind of what people call eutrophication. So when you have algal blooms in lakes and rivers and coastal ecosystems, almost all of that comes from agriculture, from kind of nutrient runoff from farms. So one of my colleagues calls this the other inconvenient truth. So if you watch Al Gore's movie, know about climate change, basically fossil fuel production and consumption being the problem, but agriculture, direct modification of the land surface, is another inconvenient truth. So even if we solve the climate change problem, we will still have major environmental problems related to our food production system. So let's say we manage to transition to 100% renewable energy. We'll solve the climate problem, but we'll continue to have biodiversity problems, water use problems, water pollution problems. So when tackling this problem, it's very clear that if you look within the sector, that kind of red meat consumption, red meat production, and dairy production is one of the biggest, has some of the biggest footprints on this. So if you had to think of where you can where you have the strongest leverage, that's where it lies. But most of the policy solutions, until recently, I would say, have been focused on the kind of supply sides, and including my own research, I focused a lot on looking at the farming landscape. Most of my research is on where we have crops and how can we make farming more environmentally sustainable. So things like sustainable intensification, organic farming, those are the kinds of things we talk about. But more and more, it's becoming increasingly obvious that we have to, that's not enough, that we have to start looking at the demand side as well, and think about things like shifting diets and reducing waste as a major leverage point. And I think that's exactly where the Canada Food Guide and the Wheat Lancet report comes in. What's really interesting to me is that these guides that were developed primarily for health reasons, for human health reasons, are also consistent with what you would come up with from an environmental perspective. And so it's sort of a win-win situation there, where a diet that's good for human health is also good for the planet. And I think it's in the health community that the whole idea of planetary health has come out, and I think I really appreciate that point of view, that human health is also good for planetary health. Thank you.
Okay, my name is Masa, and first off I would like to thank the organizers for inviting me to be on this panel. I just joined UBC a few months ago, well, actually no more few months ago, it was January 2019. It went by so fast. So before that I was working in the Clinical Epidemiology program at Ottawa Hospital and Statistics Canada. So my overall program focuses on using larger scale administrative data as well as national nutrition surveys to evaluate the diet-related burden of mortality and morbidity that is the current focus of my research. And I would say our group were one of the main critics of the old 2007 food guide, and I would like to congratulate Dr. Hutchinson and Health Canada for taking it's an amazing step towards an evidence-based, rigorous new food guide for Canada, which meets the needs of Canadians. And I would say one of the main criticisms to the old guide that our group and others had were the sole focus of the old guide's modeling strategies and modeling process on meeting the nutrient recommendations of Canadians in the old days, and just kind of forgetting about the discrete, associations with health outcomes. But in the new food guide, what we have seen as a strong contrast is the focus on health associations, which is amazing. One thing that makes me wonder, however, is the place for discretionary calories. And discretionary calories are the calories that are derived from, let's say, alcohol intake, calories of alcohol, solid fat, and added sugars. And our previous studies and others have shown that about 1/3 of Canadian diet is comprised of, in terms of calorie, of those discretionary calories, right? And it's even the worst among teens and more vulnerable populations. So I wonder, the fact that discretionary calories have equal contributions to diet-related burden of disease. So it's not just fruits and vegetables and plant-based diets that can contribute to burden of disease, but also those 1/3 of calories that are in there in the food guide. So I wonder, what are some of the strategies that nutrition communicators and healthcare professionals can take to translate the visual graphics, the easy guide, right, to their patient, public, to schools? How can we translate this guide, which is so much focused on healthy foods, which is admirable, but I wonder, where is that 1/3 of calories, and how can we translate this so the public is not confused this time around?
But yeah, I think I'm still on, is that correct? Certainly what we tried to do here, of course, is that the first guideline is about those healthy foods. But the second guideline is very much about those foods that you should be really cutting back on, so. And these has to do with basically the processed and prepared foods that are high in the sodium, high in the sugars, and high in the saturated fats. And you're right, our analysis is very, of course, it's the same analysis because we're using the same data sets in terms of what you call the 30%, which is coming from foods that people just, it's not that people shouldn't be eating it, but they're not contributing to healthy diets, is really where it is. And so, so we're trying to move people in that particular direction. I talked about the specific example of really focusing on the water, so that the message there is that you should, sugar sweetened beverages, you should just not be having sugar sweetened beverages. The other approaches that we've been trying to take, of course, have to do with reaching out to kids. So stop the advertising of these unhealthy foods that are contributing your sugars, your sodium, and your saturated fats to kids right off the bat. Now, we're not quite there yet, and I hope that in this government, as it goes forward, will choose to continue to fight that particular way. I think that another initiative that have been worked on, certainly over the last few years, that where it's not just the advertising, but where you actually have what other countries would call warning labels on foods that are high in the sugars and the saturated fats and the sodium. I think like Chile has done, like Uruguay has done, a few others, not many actually, have done that sort of thing. I said the government that I was part of, at least, they were to the point of the final regulations, but that didn't go through. So I can't say anything about how they're going to go forward, but I would hope that would do it, because it really comes down to changing the food environments that people find themselves in. I gave the example of what University of San Francisco did basically by just getting rid of the sale of all of these things, and how that seems to have had an effect. It was a 10-month intervention, not a year intervention on that particular one. Really quite quickly to see changes in parameters of insulin resistance, to see changes in girth, to see changes in terms of consumption of sugary beverages dropped completely. I mean, in some ways it seems, it was Yanni Friedhoff, I think this morning, was writing about that particular study. So, it seems like a no-brainer. If you take away the stuff, then people won't have it, but people are free to bring in what they want to have and what they drink. But people adapt very quickly to having water. You see water up there, you'll have the water, but it takes a while for it to come across. But that's where it can't just be guidance. It can't just be the food guide saying, this is the pattern you should be going for, and raw, go do this. But you have to take it into other policies. You have to see that, and again, my personal view, I'm not a government of Canada, I have to say it again, I'm not a government of Canada, I'm not allowed to talk for the government of Canada. But when you go into a hospital, in healthcare, and you're surrounded by these quick service places that are at the bottom that are not selling stuff that's particularly healthy. You want to look, you look at what is being served to people who are patients who are sick. They should be having healthy foods. They do sort of follow. You made the reference to the old food guide where it was really about the different micronutrients and the nutrient. They have to follow those sorts of things. But as you said, there's much more than just about the micronutrients and macronutrients. There is the relationship of different sorts of foods with health, and you have to start doing that right at these different places. So there's this group called Nourish. There's about 3 or 4 groups across Canada called Nourish, but one of them that's about looking at hospitals and how do you actually move to having healthier, sustainable foods offered in hospitals as well. So there have been some really neat studies at Saint-Justine in Montreal that is really has changed how they actually prepare their foods. Like, it's not prepared ahead of time. People actually order, and you come in and you sort of get what you want. And what that does is, it might cost more to actually get the food there, we'll say, but there's hardly any waste now. And the food that they're buying is food that's going to be eaten, as opposed to buying a whole bunch of food that gets prepared en masse, gets delivered, and doesn't get touched and gets thrown away, and then you have the effect on the environment as well as it being thrown. So they've sort of revolutionized their approach. And it's sort of the cost, the benefit of not having all that loss in there. So we have to, again, it's really looking at very comprehensive sorts of policies that have to be enacted that are consistent with, certainly I feel very strongly, have to be consistent with their dietary guidelines, which again is very, in my reading, is very consistent with sort of what the Lancet folks are saying as well.
And I'm Rachel Murphy, and I'm an assistant professor in the School of Population and Public Health, as well as a scientist at the Basic Cancer Agency. I'm a nutritional epidemiologist, and my interest is in nutrition and body weight and the impact of that on chronic diseases, and specifically cancer. And part of my aim is also to influence prevention programs and policies through generation of evidence. And that was actually kind of where I wanted to lead this next discussion, because I think every time I see you speak, you have this amazing insight into the healthy eating strategies and food policy in Canada, and I find I was coming up with so many different questions to ask you, so I'm trying to limit myself. All good ones. But I actually wanted to build on our conversation that we had before this, where we were speaking about generating evidence that will be used to inform policy. There was a few places in your talk where you had mentioned that the evidence base wasn't strong enough. So you had mentioned it with food skills, for example, but also thinking about the sustainability piece. I hadn't realized before that the systematic reviews is really what you're considering to be the gold standard. That sounds like you don't consider modeling approaches. I just wondered if you could maybe provide a little bit of context on that. So how can we as researchers generate evidence that will be used to inform updates to the food guide? And specifically with sustainability, we're really at such a critical time point right now. So are we really able to wait to have systematic reviews, or can we look to modeling approaches?
I like modeling approaches. I think I made reference to what I share most with my other colleagues across government had to do with modeling approaches used by the sustainability folks at the University of Oxford, where they did modeling up to 2050. Where it becomes problematic is when you are actually using as evidence the development of policies that also include like regulations or laws, because what we run into in government, of course, is that the Food and Drug Act is criminal law. So if you are basing your recommendations or your policies or your regulations or your bans on something that you don't have a solid evidence base that you can walk into a court of law with your experts and say, this is why we're doing this, you have to be able to defend it. And we don't have just the criminal law, we also have charter challenges that we can get in Canada. So that's a different sort of legal structure that we have to deal with as well. And there, of course, these are things like freedom of speech sort of thing. So if you think of the advertising side of things, if we prohibit certain types of advertising, we have to be able to stand up in a court of law and say,
we are taking away your freedom of speech because it's having this deleterious effect on your health, and I have to have solid evidence. So we get constrained somewhat when we're developing public policy, which can be part of a legal system, especially, again, the regulations and the bans and stuff like that. And what we tried to do all along with the dietary guidelines and the evidence is that we're trying to build a common evidence base that we use for all of our different processes. Of course, we do lots more looking at evidence. We do lots of modeling. Don't get me wrong. We do tons of modeling for our approaches, whether it's just with our dietary guidelines, but also with respect to what are the type of model when we try and decide what foods can't be advertised to kids. And, some of the policy work that we did over the past few years as well. So that's all there. But we just have these constraints that we always have to be aware that when you walk into a court of law, will you be able to defend this? Because I don't want to come up with a proclamation or regulations or laws saying one can't do this, and then you lose all of it because you go into a court of law and you get ruled against. So unfortunately, that means we're a little bit perhaps conservative with respect to where we can go, but again, you have to, the food guide itself is not a law or a regulation. I have a bit more flexibility there. But the other sorts of levers that are part of the healthy eating strategy, they're part of the food policy for Canada, do sort of incorporate the laws and the regulations.
So Kai, I would actually love to ask one question that expands on that a little bit, which is, you've been talking about the fact that, the food policy is based on a large body of evidence, and the core of that is systematic reviews, and at the same time, as a person who doesn't inhabit this world, even as people who do inhabit this world, we're bombarded all the time in the media by stories about what we should and should not be eating that I'm guessing are not usually coming from systematic reviews. And I'm sort of curious, what advice you would have to people out in the world who read news stories about how to interpret.
One's almost tempted to say, don't even read them. But
don't read that.
That won't work. That won't work. That's a really hard one, and because we are bombarded from so many different places by so many different supposed experts, and by so many non-experts who are very clear they're not experts. The Gwyneth Paltrows of the world, they're not experts, and nobody thinks that they're experts, but they have incredible followings, and so whether they make some sort of proclamation, that really just hits people that I can't even come close to doing. I just don't have those numbers. And we thought about, 5 years ago we were thinking about this, and that's partially why we put so much effort into the consultation to make sure that the other sorts of, whether they are, the docs, the dietitians, the public health folks, the nurses, are sort of on board for, we do something that has the best available evidence that they can stand behind, provinces and territories, so that, again, the consistency of messages are coming from reputable people, or at least there. And then, as a federal government person that I was, it's hard sometimes to respond aggressively to misinformation as well. It's not, by the time you get approvals, it's like 5 weeks later, and we're not always really fast enough. But what we've been doing, you sort of work with other members who can do that. So again, we work closely with Dietitians of Canada in terms of training their spokespeople so that they actually have the right evidence so that they can respond quickly. Or I've seen sort of our colleagues at Diabetes Canada who have, as soon as something comes up, they'll write the stuff right away, and they've got all the stuff and being consistent with that. So part of it is building the relationship with the folks that can be spokespeople quickly, not necessarily in government, but whether it has to do with the non-for-profits or the professional organizations, that will bounce back right away. The academics will sort of bounce back right away. That is essential. We all have to work on this together. Part of part of the problem, let's just even consider academics. It's a lack of academics in here too. Sometimes I think that having been at CIHR, when we developed this whole thing about everyone has to become an expert in knowledge translation, and again, I'm definitely not Government of Canada when I'm saying this, sometimes I think we created a monster here, because what happens is that there's this expectation that every scientist, then, you know, when they find something, publish something, well, then they have to go out and talk about it. And of course, their dean and their chair sort of wants them to talk about that as well. And of course, the administration says, oh, good, let's do that. But of course, what gets usually reported on are things that go against what is sort of the norm. So individual studies that go against the norm are the ones that are encouraged in universities as well to sort of be out there and sort of get airtime as that. But then what should be a reputable person is talking about his one individual study. And usually the individual scientists are very good at saying, this is just one study. We have to look at it. But because it gets picked up and put and written by the folks over in administration and stuff like that, what it does is it sort of weakens the messaging that comes out of folks. And I have to take some of the blame on that from when I was at CIHR, and we sort of started pushing that everyone's an expert in knowledge translation. Well, to me, knowledge translation, now my perspective is knowledge translation is a very specific skill, and other people have different skills, and we have to work differently, I think, in getting those sorts of messages done. I mean, that's one example of where I think in here we all sort of have to take a little bit of responsibility for being clear about the messages that get out there.
Thank you so much. So I think we've got about 20 minutes left. So at this point, let's open it up to questions from the audience, either for our keynote speaker or for our panelists. Would anybody like to, we have a microphone out in the audience, and we have a question down there.
Hi everyone, and thank you for coming tonight. My name is Verena Rasa. I'm a PhD student here at the School of Population and Public Health. I have a question for you, Dr. Hutchinson. You mentioned several times that for this particular food guide, you did not consider evidence that came out of industry sources, and there were also no meetings with industry representatives behind closed doors. And I think that's really quite remarkable, right? And I'm not sure, but I want to say that's almost a precedent in terms of, you know, developing food guidelines, but in policymaking in general. So I'm curious, what were the factors that really allowed you to take that approach this time? Was it pressure from the public, or was it individual leadership within the government?
I know the answer. I'm trying to decide what I can say. We were aware that this was a problem. We were aware that the perception of interference by industry on our dietary guidance was a problem. You know, whether or not that interference really happened is a different question, but perception is reality anyway. Right? So we knew we had to deal with that. And certainly my group, my policy group, when we were sort of chatting through all of this stuff, and this really goes back 5-6 years or so, trying to figure out, you know, as we go into this, what could we do? And we decided that this had to be one parameter that we put into place, both with respect to where the evidence was coming from and with respect to the consultations, that it had to be done, at least the consultations had to be in a very open, transparent way so that everybody knew about everyone we talked to. That was there. Looking at studies, these big reports that were done by industry, we knew that that was problematic. And it's not to say that industry doesn't produce good research, but sometimes they're saying, you know, what is the good research and what's not there. But again, we know from things that have happened. Say, University of Colorado had this a big program with respect to obesity, which we found out just about 2 years ago, I guess, that basically they'd been controlled completely with respect to what they were saying by the industry that had supported them, where we all thought, well, this is an academic group, but it was supported so strongly by industry that you couldn't. So we knew we had to deal with that. And I must say that this would have to be clear, when we had discussions with different levels of bosses, it was really about sitting down with people and getting the support. And I must say, I was really surprised myself that when I put forward that particular proposal, that all the way up the chain I got support for these particular approaches going forward. At the time, it was strictly about the food guide. So we're talking about the food guide. We want to make sure that, you know, anything we get in, we talk about. Don't talk to these guys. Look at the evidence. Got support to develop that. As we developed that, my assistant deputy minister was the one that said, you know, we should take this across, it's not just for the food guide, but this has to apply across the whole healthy eating strategy. And so this thing about openness and transparency, and when you meet with somebody, you put it up on the website, you know, within a month, we're posting everything up on the website. Who came, who you're talking to, what you were talking about. If there was exchange of documents, they're on the website and everybody can get that. Well, that has gone from being not just about the food guide, it goes to everything in the healthy eating strategy is there. My assistant deputy minister, my boss, has now extended that as well to natural and non-prescription health products as well. So when they have their meetings, they are posting those as well, and they're looking about putting that across all of the pharmaceuticals as well. So that particular policy is sort of being taken further, and my deputy minister loves that policy too, and now he's moved on to become deputy minister of industry now again. But he was very supportive as well of the suggestion as well. So it was a surprise to me that I got such good support for what, it's not just my idea, it's my group. I have some really great people that worked for me. And, we got that, and people from elsewhere are watching what happens there. You know, I've been in talks with WHO Euro. We've had meetings about, in terms of collaborating with industry, when do you collaborate, when you don't collaborate. We also developed policy on that about 5 years ago, where you know, it's not just a yes or no if you're sort of going to do sorts of interventions. Sometimes on the ground it is advantageous to work with people that have different skills and have different sources of money and expertise. And sometimes working with industry makes sense, but you have to put conditions and you have to mitigate for any sort of perceptions of inadvertent advice that's coming in, and you have to make sure that you remain completely in control of what is being said as well. So we developed all of that, and certainly in February I was over at WHO, and you know, that is their policy going forward as well. It's in consultation right now. Now I was the keynote talker about that particular aspect over in February on that. So I know that this is being picked up by other countries. It's certainly being picked up by the World Health Organization as being something you have to be really serious about as you're doing these things. Now there are countries, well, like Italy and the US who don't like that. We're very critical of our approaches.
I see another question back there, and do we have anything from our online audience to go to? Okay, we'll stick to folks in the room.
First, I just want to say how great it is to see colleagues from SPPH, FNH, and IRES on one panel. We should do that more often.
And go in Ireland.
My question is going to be about nutrition
Are you going to introduce
surveillance.
yourself as well?
Oh, sorry. Hi, I'm Jennifer Black from FNH. My question is about nutrition monitoring and surveillance, and whether Health Canada, you think, or if any of you have tried this yet, to try and figure out how we can now assess compliance with this kind of food guide. Because in previous years, Health Canada had developed a surveillance tool that really allowed us to ask, to what extent are Canadians adhering to previous food guidance, which had sort of clear and specific guidance. And I was recently an external examiner on a thesis that tried to do it, and you just really can't do it based on the snapshot or current guidance. So either the panelist, how might you actually try and monitor and assess whether institutions or individuals are adhering to this kind of guidance policy?
Well, certainly while I was still in Health Canada, we were working with different academics as well to actually bring that in. Because I'd been gone for 4 months, I'm not quite sure where that went from. We actually had, I can't remember, it was a postdoc or a doctoral student from Université Laval who was in our office actually working with us on specifically that question, and of course being in contact with Benoit Lamache and others as well in terms of, because Benoit's done a lot of work. Benoit Lamache is the chair of nutrition at Université Laval, who does this sort of work a lot, and so we're trying to figure out how do you actually incorporate these sorts of things. Now, unfortunately, I don't know what the last 4 or 5 months has happened there. I know that there was certainly a very strong interest, you know, hired people to come and actually work on that, academics who were doing that in their previous life, sort of think about how you can adapt it. And I know that they were talking to other academics as well, but I had already sort of
step back off my role.
So I just maybe say if you talk to your people, remind them that's really important.
It's not my people.
Or that your old people.
My old people,
Because
yeah.
even it sounds like BC Ministry of Health, they're starting to recommend institutions actually use the 2007 food guidance. So that's going to be a bit interesting.
Yeah, I know. Certainly in the spring when I was out, I went to every Ministry of Health across the country, and we heard very strongly that was, and we knew that as well, of course, that was an area of concern from even meetings I had across the road here as well, not that long ago. All I know is that they were working on. I'm not in a position to be able to say what they're doing going forward.
Maybe I'll just add one comment to that is, yeah, absolutely. I think the Healthy Eating Index is based around 2007 food guide. I have a paper publishing right now that I thought, oh, we better sneak it in before people come back and say, well, why aren't you using the updated food guide? And then we don't know what to do. So certainly I think from a research perspective as well as an application perspective, it is potentially problematic. We were also talking at the end of your talk about how the plates are very similar between the Lancet Eat as well as what you presented, but the Lancet Eat does provide you targets in these ranges, which I think are really helpful for the application, because I think sometimes guidance that's eat more of or eat less of is very vague and difficult for people to implement.
Yes, so me, Hassan Hutchinson from Bowen Island. I like actually how the Lancet put in the range there. Because some of the problem that comes up when you actually come out with modeling that says so many servings of this particular thing is then people get really strict and say you have to have so many of those particular things, whereas, and we've done tons of modeling, but you can do lots of modeling with different sorts of patterns that are healthy as well. And so the problem is that people eat so many different types of diets in Canada, which is fine. We have huge differences, the sort of cultural backgrounds, or people who just arrive from particular countries, and how do we adapt to that as well? And that's part of what we were trying to do, is to make sure that people could reflect themselves in it and not be caught by these hard rules of having so many of these, so many of that, and so many of that. But I think the idea of moving towards sort of ranges, because even in Lancet, they're quite clear that doesn't mean that everyone around the world should be eating exactly X number of servings or X number of grams of this particular thing. They talk about how you really have to adapt it to the culture that you are in as well. And you can actually have quite different patterns that are still healthy, but that's when you're using the different ranges that they put forward. But that still makes it really difficult for you're evaluating whether people are following guidance. If you've got guidance, then that is just so broad with these huge ranges, but it's at least closer.
Good evening, my name is Paul Kershaw. I'm also a faculty member here at the school, and thanks so much to the school for setting up such an interesting panel, and to the panelists in our keynote this evening. I was hoping I could put Naveen and Hassan more in dialogue. As I understand it, I'm not a nutritionist expert, so a little bit out of my field here. This is a leveling up, the most recent Canada Food Guide, and that seems really exciting. And I think that going forward, Hassan, you've been talking about how we can use this food guide and maybe future food guides to help transform our food environment. And I heard Naveen saying this is an important thing for us to think about at the next iteration of a food guide, because your work is increasingly showing that we need to be changing not just the supply of food, but the demand side of the equation, which will ultimately then change how the supply forces are evolving. And so I think about my own food choices, and I want to know not only like how many vegetables do I have on my plate relative to what kinds of proteins and so on, and Naveen is saying those choices can help me be more effective as a global citizen, having a lesser impact on the environment going forward. But some of my choices about what goes on my food on my plate could be like, is this local or is this coming from afar? Is this produced with a lot of chemicals or not a lot of chemicals? And to what degree is the food guide imagining being able to offer that kind of guidance going forward as a way to engage with the beans out there? Like that would contribute to shaping demand differently.
I would imagine going forward that will be a long time before we actually talk about you know, whether you're talking about pesticides, organic, whether you're talking about the footprint per se would necessarily get into the food guide. That's a long way off. Partially because some of those factors have to do with food safety, which are completely outside of the responsibilities of the group that are in the food guide. So you have to take that conversations higher. And that's where you then run into the larger food policy sort of work that's going on. When you think of sort of environmental, well, you were talking about sort of what happens to the water with the runoffs when you put it in lots of nitrogen or phosphorus, or it gets into that. I mean, the Department of Agriculture actually does lots of work in terms of actually going towards a more environmental approach and more finer approaches of using pesticides, using fertilizers if you are using those as well. So, I mean, they are already on a route where they feel that what their recommendations is moving towards a more environmentally sustainable farm as well. Now, you know, when we open up the discussion and it's not just one department, then we actually start listening. Then we look at other possibilities as well to go further. So I think that this more comprehensive approach will depend on how the government in the short term at least goes forward with the food policy for Canada. Are we actually going to have a good, strong advisory group with different sorts of expertise represented in that advisory book that will be looking at us putting forward, developing a very strong food policy for Canada that takes into consideration the environment, that takes into consideration fisheries, that takes into consideration health, that takes into consideration food safety. I mean, I think that will be doable in the long term, but you have to have the commitment of the government to be able to do that. And I'm in an unknown situation.
Yeah, I mean, in terms of what the research evidence shows in terms of those choices, we talked about 3 different dimensions, and I think all of us make this choice. Do we eat local or from afar? Do we eat organic or conventional? Or do we agroecological? Or, and then, you know, do we eat more plant-based or not? Broadly speaking, I think across those dimensions, it's pretty clear that there's lots of what people call life cycle analysis that have looked at the impacts of eating local versus not, and most of the evidence is that nearly 80% of the impacts seem to happen on the farm, and only about 20% of the, say, greenhouse gas emissions occur along the supply chain. And so, of course, there's a lot of context in this. So these are general patterns, but generally speaking, if you had to think of a leverage in order to solve climate change, it's not with eating local. I would say the same thing happens with organic. I've done, one of my PhD students did a lot of research to keep comparing organic to conventional agriculture in terms of a suite of different dimensions. And broadly speaking, organic agriculture does seem to have environmental benefits, but it has lower yields. So if you compare the two systems per unit product for the same amount of food produced, then the environmental benefits seem to go away. So there's a trade-off, essentially. There's an environment versus production trade-off. So my own kind of common sense sort of rule of thumb is that the biggest leverage you can have in your food choice is to go more plant-based than the other two. Of course, if you can be more plant-based and support local and support organic, that's better. But if you are trying to choose between those 3, I would probably, right now I would say, go plant-based. There was a review paper published last year that came to the same conclusion.
All right, I don't see any more hands shooting up. Oh, do you think we have time for one more? All right, we'll do one more quick question and then we're going to wrap this up.
All right, thank you so much for taking my question. My name is Yvonne Lammers. I'm also from the FNH department. I will be Canada Research Chair in Human Nutrition and Vitamin Metabolism. I guess that's where also my question will be going. I do very much miss micronutrients on this plate. While the plate itself, you know, with a variety of fruits and vegetables, I want to echo Masa's comment on the reduction of disease. Chronic disease is definitely very important, but I think there are various aspects that are not captured, and working with clinicians in the hospital, my research work, but also in practice, they do have really a problem of translating this into actual daily portions and diet, but it should be quick. So my question is more seasonality. I don't see this addressed, and most important, I don't see food insecurity addressed in this plate. fresh fruit and vegetables is hardly affordable for many Canadians and for an increasing number of Canadians. It's non-existent in hospitals where their daily budget goes down from $2.70 a day to $2.30 a day, and they cut out the orange juice in the morning. So how you had mentioned hospitals earlier, and I do appreciate that there's the interest of Health Canada to have this be reflected in our institutions, but how is that feasible with the high level of food insecurity in Canada? People, I doubt they can afford what we propose them to eat.
Yeah. Well, first of all, I think that you talk about the cost of the plate, but it's not fresh, and even sometimes I think the biggest mistake we made is to make it too pretty, that plate, because what's on that plate actually, there's a fair amount that was frozen, canned, dried, as well as fresh, but we did such a lovely job, I think, in taking the pictures and stuff on that you might sort of lose that. And so a lot of our the work that has happened since then has been to reinforce that. So I mean, I don't know if you were aware, but we have sort of monthly newsletters that come out of Health Canada that sort of address issues that have been coming up. So there have been actually a number that have to do with food costing and sort of trying to push forward that we're not talking about all fresh there. And then I know I went really quick, so I don't think I said that on the slide. On one of the slides, it talks about the selection of the foods that are on this diagram are a combination of there are some fresh there, but actually most are not fresh. But we did such a lovely job at taking the picture that I think you lose that. And as I said, from a costing perspective, comparing it with the previous food guide, I'm not saying comparing it with what people are eating normally now, there was actually a decrease in cost with the new one as compared to the old one. I know that the Brits, when they did the costing of what people are eating now and with their dietary guidance, which is not that different than what we're talking about, it was as cheap to eat healthy in England, actually, with the modeling that's done in England, as what it was to eat what people are consuming right now, which includes the unhealthy foods for them. And that's not taking into consideration the effects that has on their health, just straight up cost. Now, that's a little different in Canada because when you think of costing in Canada, in Britain everything is, in England everything's really close, and so you don't have these big variations. We know that we've got big variations in costing of food for different parts of Canada, so that analysis has not been done yet, so I don't know what we'll be saying in Canada. I would say that that's probably true for people who are living in large southern urban populations, but again, that's just a supposition that I have there. So I don't think, first of all, this is not all fresh. This is canned, this is frozen, this is preserved, healthy preserved in there as well as fresh. I agree with you that the part of the problem has to do with food insecurity is huge, and that's something that actually my group is responsible for the initial analysis of the food insecurity rates for Canada as well. We're the ones that work with Stats Canada to make sure that those surveys are actually happening as well. We worked very closely on those since about 2002, or actually planning started way beyond before that. So I agree that's there, but that's why. But we don't really have the tools in health to make a difference about food insecurity, which is kind of problematic. But that's where it's really good when you actually are working with these larger food policy for Canada, because then you can be talking to the folks that are responsible for putting together a poverty reduction strategy, making sure that the Val Taraseks of the world are actually being brought into Employment and Social Development Canada, strangely enough, to talk to them about their poverty reduction strategy. So we certainly have to look at the different levers, the different approaches we have to deal with food insecurity. That's why it was a part, one of our chapters was all about the inequities and stuff in our thing, and realizing that so much of it, the tools to deal with that are outside of my domain. All I can do is make sure that we build as much the costing into what we bring forward. We're also the ones that are responsible for putting together the costing tools that we have used, and I know that they have been working on that. I'm not quite sure where that is anymore. That is then used in the surveys in terms of costing of foods. And so we'll actually be having some more data on the costing of foods across the country as well, going forward. Now, part of the problem with costing of foods is that that tool gets used differently by the different provinces and territories, so it becomes a little bit difficult to compare them. But we're trying to build it into some Stats Canada research so that you actually have a tool that's used in the same way across the country for food costing. So we've done that. We have actually, when we did this, we worked with Stats Canada with food costing databases as well to try and look at how do you actually control food costs. Now, I don't say we did it completely because we didn't necessarily have the, everything to do that. So I don't want to claim that we did this using cost. We used indicators of costs, a certain number of foods that we followed as we were putting together this particular plate. Part of the problem when you come up with a healthy eating pattern, if you reduce the cost, then you lose your variety. And so we did have sort of trade-offs in the modeling. I mean, we do lots of modeling in terms of when you're looking at sort of patterns of eating, between people being able to have enough variety that they can see themselves in the pattern and have lots of different healthy eating patterns, and cost. So we've played around a lot with that as well. This is not an overly expensive, 1 minute, wrap it up. Yeah, but the cost is there, and that's why we've put so much effort since the launch to actually, as I said, we have materials online to really help people. Like what I showed about, flashed up online about seniors. There was a lot of costing in terms of cooking for 1 and 2 and things we do. We've got lots of that there. We have costing, sort of cost of food advice as well, that you can go in there and have some suggestions at least in terms of how you can control the costing. Yeah, so it certainly is something we're aware of as well. And food insecurity. I mean, it's huge. I mean, they like to say that it's only in Canada 8% food insecurity, but of course when you look at different population groups, when you look at Nunavut, and it's up around 60 and above %, or Indigenous peoples being more around that 30 to 40% sort of food insecurity. Inner cities being really high as well. Single mom households being very high in food insecurity. It's not just 6 or 7%. It really happens for the individuals. There's lots of individuals that are affected. That's much larger than the Department of Health to actually make the response. But that's part of our job, is to look at the data, to make sure Stats Canada is getting the data, that we are aware of it, and that we are sharing it with our folks that can have an effect on it.
Okay, thank you so much. We'll wrap it up thanks to Dr. Hutchinson, to our panelists, and also to Emma, Stefan, and Simona, who organized this event. And this is just a final reminder that our next Voices in Health event will take place, it says here, I'm not sure if it's here in this room, but on December 9th at the same time. Thank you.